Well, good afternoon, Facebook, and welcome to another episode of Dr. Stem Cell Dr. Patel TV. We are live on Facebook. I'm your host, Dr. Jason Deitch, of course, with Dr. Patel. Good afternoon.
Good afternoon. Great to be here as always. How's everyone
It,
doing?
it's a great Friday. You know, I'm here in Northern California. You're in Southern California, all the way on the left coast. And, the world is crazy, but we're still here and people still need help. So the show goes on. Today's a great title. I'm excited. I don't know if people know, not only am I the host, but I'm also a chiropractor. No longer in practice, but I was honored when you made the suggestion. Hey, let's talk about chiropractors. You mentioned you got some feedback from one of our previous shows. So let's get right into. Why don't you give us an update as to what's going on in the practice this week, and let's have ourselves a great conversation. And if you're watching and you have questions, now's a great time to ask them.
Yeah, well, the truth is, over the course of these last several months of us having these collaborations and talking, I think it's been a wonderful experience of us being able to learn more about each other and all the different types of things that are available for patients. And the truth is, there's a lot of different things that people are bombarded with when it comes to options for pain care, options for pain relief. And the question ultimately comes down to is what is in a patient's best interest? And this is something that we've kind of talked about a lot over the course of the last several months. Um, you know, we had one session earlier about why I like chiropractors and why I like chiropractic care for my patients. And I talked in that session about why I like chiropractors, physical therapists, osteopathic physicians that do manual therapy, and ultimately the take home, in my opinion, from that session for people to take home and realize was that not one solution is the best cure for your particular condition. Um, when we talk about pain, traditional medicine looks at what's the pain generator, what's the thing that's causing pain. But oftentimes, it's not just one thing that's causing the pain. Sometimes there's multiple things that are causing pain. Sometimes there's multiple things that are causing that one thing to cause pain. And how is it possible that one magic treatment is going to treat that whole condition? Truth is, that's just not the way the body works. So I really appreciate all of my chiropractic brethren, my physical therapists, my DOs, my acupuncturists, my nutritionists, my functional medicine doctors, all of those that are really collaborating in order to get the best possible outcomes of your medical problem, your pain condition, your injury. And that's why I really wanted to focus today, because of the fact that we have such an experienced chiropractor with us here in you, Dr. Jason, is that we want to know more about chiropractic. I think I've had some patients come to me and say, I've gone to a chiropractor before, and then I went to another chiropractor, and it was a totally different experience. Or I went to a physician who completely poo-pooed chiropractic, and vice versa. So, what is chiropractic, and why can it be beneficial? That's really one of the main things that I want to address with today's session.
Yeah.
Before I go on and get that information for you, for those of you that are watching that don't know me, I'm a DO, which is different than an MD. A DO is a doctor of osteopathy, and there's two major differences that differentiate us from MDs. Number one is that philosophically, we really are focused on the whole body, and we have some specific tenets that really look at the whole body and the body's ability to heal. And number two is that we do learn osteopathic manipulation, which is a form of manual therapy that actually has a lot of overlap and parallels with chiropractic. So I've always used my hands with my patients, whether it's diagnostically or as a part of my treatment. But what is the difference between a DO and a DC, a chiropractor? And And why do I rely on chiropractors for a part of my patient's care? These also are the things that we really want to delve in today. So, first and foremost, Dr. Jason, tell us more about chiropractic. I'd love to hear from you.
Well, how much time do you have? No, I'm just kidding. You set that up perfectly, because what you said and what you started off with really was philosophy. And I think that's one of the most important things for people to understand is, and one of the things, I do a lot of different things within the profession. I'm no longer in practice. I retired about 10 years ago, and I really help on a more sort of institutional professional level. But that word, that understanding that the way we think about what we do precedes what we do. Just like we've talked about in previous episodes, there's lots of DOs, lots of MDs, but you have a different philosophy than the others we've talked about in the past that are just focused singularly on how do I get rid of the pain at all cost. Meaning, if that means lots of steroid injection after after injection after injection until you need surgery, according to them, that philosophy says we got rid of the pain the best we could, and the pain is relief of pain is the problem and solution. When you ask or when you bring up the concept of philosophy, that really is the differentiator. And if there's one thing I'll say I'm sort of self-critical about our profession that we don't do a good enough job at, and I lecture around the world literally about this very topic, and that is how difficult it is for people, for consumers, to understand not only what chiropractic is, but who they should see for care, because there are so many different, you may call it philosophies, but let me make the metaphor. One of the challenges is it would be like all attorneys referring to themselves as an attorney. And you'd say, oh, well, I used to work with a tax attorney, but I moved. I asked my friend for an attorney, and I went to a new attorney, and they're asking me about, criminal problems. That's a totally different experience than my tax attorney. Because they all have the same name, it's very, very difficult for consumers to differentiate what specialty that they have. Nobody would be surprised if they went to a divorce attorney and then a criminal attorney and say, wow, the experience was so much different. Of
Yeah,
course, it's different. They have different specialties, philosophies, goals, and outcomes. And
great point.
that's really kind of the first issue to clear up with people is that chiropractors have a whole range of, I'll call them specialties. Generally speaking, they fall into sort of two camps, very similar. And one of the reasons we get along so well is because our philosophies really are, as you said, focused on the whole person. Our philosophies, I know you have a program in your practice called Proactive. Well, that's for people who are thinking proactively. Now, if your only goal is pain relief, proactive makes no sense because if you don't have pain, there's nothing to fix.
Right.
But your training and my training tells us and really drives the fact that there's a cause to the pain. And those causes of the pain are oftentimes there for years before the pain ultimately shows up. And so, one of the really major philosophical differences that, I'll say many of us, not all, but many of us as chiropractors have is we want to do everything we can to help people reduce their risk of having pain. For
Hmm.
example, people know that if they take a blood test and they've got certain indicators, they can feel totally fine. But also, a doctor could look at lab tests and go, you got to get to the hospital. You're 24 hours away from a heart attack. You go, what are you
Right.
talking about? I feel fine. In fact, the first cause of death, the number one cause of death of a heart attack, of heart disease, is a heart attack.
Yeah.
So, the number one reason why people die in America today is heart disease. And the number one way people find out they have heart disease is after they've died of a heart attack. I say that because it's the ultimate point for people to recognize that how you feel is not the same thing as how you're functioning. So, Chiropractors, very simply, just like osteopaths, are focused on the structure of the spine. Our primary focus is because of the impact the spine, the vertebra, the movement or lack of movement, what we refer to as a subluxation, can have on the nerve system, on the spinal cord and spinal nerves. Osteopathy focuses more on the circulation, but they're such close cousins that most people, if you were looking from the outside, would never know the difference. And
Sure.
in some cases, the body, the blood vessels, the nerves, are all in such close proximity in many cases that when you make an adjustment, you're actually affecting both in different ways. So
Yep.
some of it is more of a, mental, analytical, educational, academic difference, oh, the circulatory system versus the neurological nerve system, but then there's the practice of it. And so the bottom line is there are many chiropractors that focus on encouraging people to have as healthy of a spine and nervous system as possible, regardless of your symptoms, which just makes perfect sense. And then there's others that really focus on being more pain relief specialists. When it hurts, when you've tried everything else, when you don't want to take drugs, when you want to reduce your risk of surgery, getting adjusted oftentimes can help the body heal itself for many of the same reasons why what you do works as well. So it's really just sort of the high level, what we do and the differences. And one of the things I try to do so much is help people understand, how do I find the right type of chiropractor or right type of regenerative orthopedist for me? One of the most difficult questions you get is, okay, I'm not near you. Where do I find somebody who does what you do?
Sure.
Because philosophically it is so unique and different, you're such a specialist in what you do, same, we feel the same exact way, that it's difficult to find that sort of standardization in healthcare today. But when people know how to ask the right questions, there's certain keywords, there's certain things to ask to know if you're in the right place or not. But at a high level, that's what we do and why we do it.
So that's wonderful. Now, I really appreciate that description because it goes through all the details with not only what a chiropractor does, but also philosophically how that separates from a traditional model of, just reacting rather than being proactive in terms of your health and wellness. Question for you then is ultimately, from the patient's perspective, let's say I have an injury and I'm considering seeing a chiropractor. How do I choose? Other than, asking my neighbor who went to someone that they liked, which is a very valid way of finding out, right? But what are those questions that a patient should be asking to find out, is this chiropractor a right fit for me?
Yeah. Referrals are a great place to start as far as, can I trust them? Is their office clean? Are they ethical? Are they honest? It's a great place to start. Um, I'm going to answer your question by actually approaching how I actually interview, or how I used to interview patients who would come to see me. And I would sort of say it like this: there are three types of people that come to see me. There are those people that are looking for temporary pain relief. There are those people that are looking to find and correct the cause of their pain and therefore problem. And then there are those people that are looking for optimal performance. And so, depending on how somebody would answer that question, would very much determine the type of chiropractor they would be looking for. There are those chiropractors that really just specialize in temporary pain relief. They don't focus on what I'll call corrective care, and in some cases don't focus on optimal performance care. So when people can answer the question I just asked, when they know my goal is temporary pain relief, that will dictate or drive them to a specific type of chiropractor. If their goal is to find somebody that provides more corrective care to not just feel better, but actually work on correcting the cause of the pain, that would help you find a different kind of chiropractor. The same thing holds true with performance care. If you know your goal is to, feel better if you're hurting, and even if you're not, find a chiropractor that can help you improve and enhance your health and performance. That would mean you're looking for yet a different kind of chiropractor. So the answer to the question is, first know, I'm looking for a lawyer. What kind of lawyer? I'm
Right.
looking for a
Right.
chiropractor. What kind of chiropractor? And
Sure.
once you know what kind of chiropractor, then you can really understand how to often interview them. You know, Are you the kind of chiropractor that focuses on optimal health and performance? Are you the kind of chiropractor that focuses on really adjusting the spine to remove or reduce subluxations, which are those neurological interferences as a result of spinal pressure? Is that the kind of chiropractor you are? Or are you really one of those limited specialists that's really focused on addressing the pain? And then oftentimes they may use adjustments, they may not. They may use different types of machines or technologies. They may use a
Mhm.
variety of different things to focus on the relief of pain,
To
which in
get
many
you out of pain.
cases to get
Yeah,
you out of pain, which is really a different premise than how do we keep the body functioning at its optimal performance and healing naturally to the best of its ability by correcting the cause of the problem. And so people understand what I'm talking about in terms of problem. If you've ever ridden a bicycle and you've had two links of the chain that weren't oiled in a long time and they sort of stuck together and didn't move, you'd notice there's a constant clicking every time the chain goes through the pedals. It's that stuck chain that you're not going to fix by, pedaling faster or slower. You've got to do
yeah,
something to get the movement back. That's a crude metaphor for what we're really trying to do with the spine. It's
right.
the optimal function, it's the proper movement, the motion, proper range of motion, not just because of the bones, but because of the relationship of the bones to the spinal cord and spinal nerves. And the big idea to all of this is that the spinal cord and spinal nerves are really, and you know this, the tail of the brain. The nerve system is one nerve system. We slice it and dice it and study it anatomically, academically, give it different names, but it really is the system that helps us understand and perceive our reality, understand how to coordinate all of the functions of the body, including our muscles, our ligaments, our tendons, our heart, our immunes. All the functions of the body are coordinated through the nerve system, the brain, the spinal cord, spinal nerves. So when the nerve system is not healthy because there's one of those stuck chain things that's putting pressure on the nerves, in many cases it's asymptomatic, meaning you don't feel it. But when we know it's there, we know that's an early sign to a problem that will eventually occur. So
Yeah.
that's where it becomes, up to people's philosophy. Are you the kind of person that waits until your car is broken down on the side of the road to call AAA and say, fix it, as in
Yeah.
reactive? Or are you the kind of person that says, hey, there's a light on my dashboard. I should go get this checked out before it becomes a problem? That's what many of us as chiropractors recommend. Get checked, find out if there's interference in your nerve system, find out if you have, again, what we keep referring to as subluxation. If you do, if there's nerve interference, by definition, it's impossible to be at your healthiest. So, depending on people's goals, depending on their experience and relationship with different chiropractors, that determines the kind of chiropractor you want to see.
I think this was fantastic. I'm really loving this conversation. I must say, you must have rubbed off on me a little bit because I also have, three types of patients that come see me that are fairly similar to the types that come to see you. And really it's a matter of tailoring the appropriate treatment for that appropriate patient. Because not any one patient has the same goals and expectations and purposes in life, right? If you have a significant pain issue and you are an athlete and you want to participate in, X game that you have in 2 weeks, then, getting rid of the pain right away is the right way to go, right? And it sounds like seeing that type of chiropractor that's going to make sure that you've got the pain relief and going properly is the way to go. And from my standpoint, that's the type of patient that might actually benefit from a corticosteroid injection, right? Getting that temporary relief and weighing out what are the benefits of getting that pain relief versus the risks of potentially causing long-term harm if we were repeating those type of things, right? Those are the things that we need to kind of analyze. So I think it's wonderful that you're saying that, and correct me if I'm wrong, you're saying basically if you're looking for a chiropractor, you need to ask yourself first, what do you want to get out of this?
That's right.
before going out. That sounds right?
Well, that's how you find the right kind of chiropractor. Unfortunately, you know this and I know this. Most people have, I'm going to call it, have been hypnotized by, basically the pharmaceutical industry that being asymptomatic is the goal, right? So
Yeah,
ask your doctor for
yeah.
the pill, and when diet and exercise don't work, which of course is ridiculous. Of course, it always works, if you do it. Um,
Yeah.
but we've been hypnotized through drug commercial after drug commercial after drug commercial, interrupting us nonstop. That the goal is simply to be asymptomatic, and it's just not true. Now, of course, you want to feel better and not have to feel symptoms, but the goal should be to be as healthy as we can be with the least amount of drugs and the least amount of surgery as possible. And,
Well, the
go ahead.
concept is simple. It's it's yes, the goal is to not have symptoms, but wouldn't it be better to not get the symptoms in the first place?
Precisely.
Right? So that's really what it comes down to. And I'm really loving what you're saying here. It, Here's my question for you. Let's say I'm a patient that's falling into either category 2 or category 3, that I want to, really take a look at the whole body, and I want to be proactive, not just get out of pain, but really I want to stay out of pain and prevent things from getting worse. Um, but I'm scared. I'm scared about getting adjusted, or I'm scared about, I had a friend or family member that had an adjustment that hurt them worse. So, how do I ask the questions about, okay, um, what are you going to be doing? Is this something that I'm comfortable with? How do you make someone comfortable with the treatments that you provide?
That is a brilliant question. I find that it's really people first. All right. I've seen some of the procedures, regenerative orthopedists do. Uh, and my first words are, and people are afraid of chiropractors? It's just, what? And not just, and yet it's no big deal. I mean, that's
Yeah,
sort of the point. It's very much, you can answer the same question. It is people first. And, even those people that go for, radical surgery, how do you not be afraid? You trust your doctor. And if you don't
sure.
trust your doctor, you got a problem. So it is asking the right questions. It's finding somebody that will be patient enough to answer your questions. And there's another key part that you mentioned, well, somebody went and they were sore. Again, oftentimes this is more an individual issue than it is a profession-wide issue. For example, anybody who has a procedure of any kind is likely feeling the effects afterwards. Nobody would
Hmm.
go, wow, there's some soreness to, an injection I got. Of course there's soreness. Now, again, the self, I'm a big fan of being self-responsible. So our profession's issue is that sometimes we're not as clear as we need to be in our desire to, calm people's fears. Sometimes doctors may not remember to say, by the way, you may feel some soreness after your first adjustment. That is not uncommon. It doesn't happen to everybody by far. I would typically respond to people, I tell people respond in three ways. Some people feel instant relief. They feel that adjustment, and it's kind of like taking a splinter out of your body. You go, oh, finally, the pressure is off. There's other people that feel no different whatsoever. It's kind of like if anybody's ever slept on their hand and it goes numb. Well,
Hmm.
you take the pressure off, it's still numb. You can't feel anything. It's just, and you're dealing with nerves. So some people go, well, I don't feel any different. No, I understand. Let's get the life
Give
back
it,
into the
give it
area.
some time. Yeah.
Exactly. And then sometimes people do feel some soreness. Sometimes people have so much damage, so much inflammation. And because we're working with the spine and nerve system, one of the jobs of nerves is to feel. So as the nerves start functioning again, they start feeling the damage, and you are more aware of what really has been going on inside. Again, not normal. Excuse me, not normal. Uncomfortable, yes, in some cases,
Yeah.
but Totally logical. So I think when people have a trust in their provider, when they ask those questions, when they see other people do it, we take care of children, infants, you know, petite people, you realize they get off the table with bigger smiles than they lay down on the table. Oftentimes, what we're afraid of is the unknown more than anything that's rationally something to be fearful of. This is one of those cases. It's just unknown to so many people still, that they're just like, what? I hate the noise. Well, it's
Yeah,
like it's like popping a bottle of champagne. It's the same kind of noise. It's what you
yeah,
associate with it. So, uh, asking the right questions, finding the right doctor, and communicating. It's a great same with you. People go, Doc, I'm scared. That's good to know. I can ease your pain and ease into it a little bit differently than go for it. The harder the better, which many people ask
right,
for also.
right,
so
right, right.
so clarifying what your goals are, what your concerns are, any fears you have is a super important part of establishing that kind of connection relationship.
This is what I love about you, Doc, is because you're able to put things into words that we're able to understand. And I think that's so key, not only from, for your profession, for my profession, et cetera, but really ultimately you keyed on the fact that communication is so important. And so this is something that I think is a global statement for anybody listening right now, for anybody that's seeking out medical care in any way, shape, or form, right? There's going to be some people that communicate better than others. There's going to be some people that communicate less than others. However, I implore you as a patient out there, if you're trying to get improvement for your body, it is so important for you to understand what's going on and what's being done to you. Um, it hurts me so much when a patient comes to me and says, "Okay, I went to a physical therapist and they hurt me and I had no idea what was going on," or "I went to a chiropractor and they didn't listen to me and I didn't know what they were saying," or "I went to a physician who injected something in me, and I got no better, or God forbid, got worse," right? The reality is that there's so much misinformation and disinformation out there, and there's also so much blanket not talking about information and not educating. But some of that has to do with the fact that some people are trying to some healthcare practitioners are scam artists and they're trying to hide things from you. Some people are poor communicators and are not able to talk to you because they're using scientific lingo that you might not be understanding. And also sometimes it's because we get confused, and personally this happens to me all the time. If I get confused, sometimes I kind of shut down, right? And I get nervous and I don't ask the questions. But we have to. If you're confused, if you're in a chiropractic office and you're unsure about what they're suggesting, if you're at a physician's office and you're unsure about the type of injection or whatever that's being suggested to you, ask, ask, ask. You have to be an advocate for yourself, and the communication is so, so important. Because as Dr. Jason, as you've made it crystal clear at this point, there's different types of chiropractors out there. There's different type of people that are doing different treatments. And if we don't know what we want, and if we're not able to communicate with them, then we're not going to be matching up our goals and expectations and treatments, and we're not going to be able to get you where you need to be. So, so important. And I really thank you for making that so crystal clear.
Yeah.
Um,
Uh,
last question for you. Go ahead.
well, I was just going to say, that's so true within professionals too, and I just want to sort of point out,
That's
that.
exactly where I was going.
Okay, great.
Yeah.
Uh, if you want to ask the question, but
No, go ahead.
all right. So what people should understand is the continuum. I mean, again, one of the reasons why we work so well together is because our philosophies are so aligned. A plumber doesn't go, you don't need an electrician. And an electrician goes, oh, I don't believe in plumbers. We
Right.
focus on different things. We have different specialties, and both are requirements to have a properly functioning home. Well, that's very much the same thing. If you don't know any better, you go, well, they got a tool belt, they went in the house, they did some work, they came out. Why do I need both of them? Because they do different things. And you need both of them. So that's really, I think, for professionals to understand what each other does. I know there's plenty of chiropractors that don't really understand regenerative medicine. Um,
And
so
vice versa, right?
and vice versa, exactly right. And I think that's really the dawn of this new era is how do you find sort of what I think of as local professional networks of doctors that know who they refer to and cross refer back and forth, all for the best interest of the person, the patient, the client they're working with. I say patient because patients think of somebody, well, I'm sick, I got an injury, I need a doctor to fix me. But so many people come for those proactive measures that you don't have to be a patient in order to see a doctor that's going to help you improve. So you can think of it as more of a person or a client. Um, but it is in the communication. I've learned so much from you about, loose ligaments, about PRP, about stem cells, about injections, about, stuff that my profession is not trained in very well. So
Sure.
to go, wait a minute, there's a place as a chiropractor, for those people that aren't responding to my care the way I need to, or want them to, or expect them to, or who clearly have the indications. They may have, imaging that shows, some pathology that really requires what they're being told, steroid injections or surgery. For our profession to know, hold on a minute, there is a branch of medicine that actually philosophically aligns with what we believe in as chiropractors and actually has the same exact goal. And I don't mean to correct subluxations, I mean to keep people off of drugs and out of surgical rooms when you can. I'm not saying always 100%,
Sure.
when you can. That is a common goal we have as practitioners, that more of us should be really working together. And it's really very much one of my goals. I know our goals is to get more qualified chiropractors to work with more qualified regenerative experts, as well as the other players that people need. You need proper nutrition, you need great exercise, you need to
Yep.
know how important sleep is, and stress management, life coaching. These are all different parts of what we as human beings who want to optimize our health really need. And, not to try to connect the dots too close, come to your own conclusions, but there's never been a more vulnerable and important time for us to improve our health, for us to be as strong immunity wise, for us to make sure we're doing all the things to take care of ourselves. So we're, in
Yep.
fact, a bad host. Now's the time. And there's so much we can be doing for ourselves without waiting until it's a disaster, without living in fear, without thinking that the only savior is the pharmaceutical industry. Not to
Right.
say that there's not a benefit in, some cases, some of the time, but it's not the only answer to saving humanity. There's so much we can be doing for ourselves that unfortunately isn't being talked about enough. That the more of us as doctors that can, work together and share the truth with people, I'll say the tough truth, that you're responsible for your own health. You are responsible for your own health. And the more you're willing to take responsibility and not live by this philosophy of, well, I work too much, I don't get much sleep, I'm overstressed, as a badge of honor, thinking that a drug, a surgery, or a shot or something is just going to save all of us, is just false hope. So
Yeah.
there's just a lot we can do. And I think much of that has to do with more of us as professionals working together and collaborating like we are here.
I think, all of those points are so important. If you're listening here, it's the integral piece is that we are a team in taking care of you, and that team is centered around you. Um, whether, if you're thinking about any team sport, right? If you're thinking about football, if you have an all-star running back, um, but you don't have any other players in the team, then you're not going to get anywhere. And guess what? You're the quarterback, right? You're the quarterback. A chiropractor is your running back. A regenerative medicine doc is your wide receiver. You get the drift, right? But ultimately, we need to work together, and that is what gets us the best benefits. So another thing to keep track of, and this is something we've discussed in past sessions too, ultimately, is that if you go to somebody that says that I am the cure to your condition, that I'm the one that's going to get you better, I'm going to regrow your joint with this injection into your, this magical adjustment is good. No. If they're saying that this is the cure and there's nobody else that's necessary but me, that is the wrong mentality because ultimately, at the very least, you're involved, right? So
Exactly.
you have things
Uh,
that you should be doing for yourself.
the keywords people want to listen for that, I actually coach chiropractors and other types of doctors to remember is that what we're doing is helping the body heal itself. And that's the key point for people to hear is that no drug, no adjustment, no shot, no anything fixes you. All 100% of healing comes from within. And so when you understand that, then all of a sudden everything takes on a different perspective because the goal then becomes how do we reduce the stress, reduce the toxicity, reduce the damage, reduce the problems interfering with your body's own natural ability to heal itself. And when you hear any kind of doctor speaking that way, you want to lean in and ask better questions because that really is the accurate, scientifically appropriate way to think about things. When I hear the science is settled, when I hear, oh, this is 100% true, this is 100% false, there's so few absolutes when it comes to the body that the smartest people, the scientists and researchers that aren't corrupted, bought, and paid for, forgive me for telling the truth, there's so few definitives that you've got a good doctor when they're basically leaning and saying, we hope, we expect, we often see, but ultimately recognize that the healing comes from each individual person and we're all unique and different.
It's so, so important. Now, well, Dr. Jason, I really appreciate everything that you've said. It's always been fantastic talking to you. Every Friday, we've been kind of circling back and talking about different topics. And quite frankly, today's topic evolved from learning about chiropractic care and how to ask the right questions in order to get the right chiropractor for you. Ultimately, this conversation evolved into how to be your own advocate and how to really push your own care and building the right team around yourself. So, really, really key points. This, quite frankly, might be one of the most important videos that we've done to this date because it's so applicable not only for a specific problem or condition, but it's so applicable for everybody and anybody who has any conditions, really. And not just if you have pain, but ultimately if you want to remain healthy and if you want to keep doing the things that you want to do. So, so important. Really, really thank you for this wonderful discussion today. Any closing comments from you?
I just, I want to just acknowledge you. What you do is fantastic. I love referring people to you. I love your open mindedness and really willingness to learn. That's another great thing about a doctor is, tell me more. I'm curious. Uh, Fantastic quality. I know, we've done programs where you're meeting chiropractors are meeting you, and light bulbs are going off. Many of them are going, I didn't know that. And we're doctors.
Yeah,
We should
yeah.
know that and we don't. And that's the beauty of it is that we're always learning. For people out there, listen, your health is your responsibility. There are so many things you can and should be doing. I'll just sort of share if it's all right. I created a public awareness campaign called lookupamerica.org. I'd encourage viewers to look at and check it out. it's really an appropriate thing for today's day and age because, for several factors. Looking up, number one, addresses one of the common issues I know you and I have patients and people that we know suffer from, which is tech neck syndrome, which is the impact technology is having on our neck and our spine. There's probably hardly anyone, maybe even no one, that is not using technology on a consistent daily basis that's not affecting their spine. So
Yep.
understanding, we call it Look Up America. So there's three things to look up. One, you've got to physically stop doing this and start doing this, as in look up. So you want to look up to the sky. That's one thing many people can do in the audience to help themselves. My kids are constantly down. That's
Hmm.
where it came from. Like, look up, look up, look
Yep.
up. We as adults are guilty too. So, number one, if you want to learn more about it, look up. Number one is looking up physically. The second look up is being more optimistic. You and I both know that attitude is everything. It would be absolutely easy for many of us to really live in a very negative, depressing, frustrating, hopeless attitude right now. You would
Especially
have
this year,
every
right?
right to believe and feel that way right now.
Absolutely.
And
Absolutely.
you got to make lemonade. You got to find the benefits. You got to count whatever few blessings you have. And we all have something to be grateful for. So it's a reminder
Yep.
to look up and be more optimistic. And the third look up, which is so subtle and yet ubiquitous, is the fact that so many of us don't look up at the people in the room or at the table when we are in their presence. So, whether it's kids and parents, parents and kids, friends, how many times have we all been to a restaurant and seen a couple or a family together? Nobody's talking, they're all on their phones. And so the third look up is socially put the devices down and be present to the people around you. Show the respect to get the respect. So for those people that want to learn more about lookupamerica.org, it's looking up physically, looking up emotionally, optimistically, and looking up socially and being more well connected together as a team.
That's fantastic, man. I had no idea that you did that, but this is really profound, and I implore everyone to take a look up at this site to really know more about this because it's such an important topic. I can tell you literally three patients in the last 3 days that had physical pain, mental stress, and quite frankly, anguish associated with looking down. So, so important. Great topic. Thank you so much. This has been absolutely wonderful. I'm really looking forward to talking to you more again. For all of those out there, you can always reach out to me for more information. Again, look up
ORG.
america.org. So look up america.org. To reach me, you can reach us at info@stemcelldrpatel.com. Our website is www.stemcelldrpatel.com. This is Dr. Patel here with Dr. Jason Deitch, and have a great weekend. Have a great rest of your Friday, and look up, everyone.
There you go. Be well, everyone. Great to see you, Doc. Thanks so much.
Thank you.